friends, welcome to the Nursing Virus YouTube channel. This is me, your Loganathan. Today I'm going to discuss one of the craziest and easiest subject from the nursing course, that is psychiatric nursing terminologies. We all might enjoy it well when we studied this subject during our bachelor or masters, and we used to think that when the teacher teaching and giving the example for each terminologies, we also once had those kind of experience. So that mean me also having psychotic disorder. Like that queries will used to happen on our every individual persons who did or who are doing the nursing program. So don't worry, you are not suffered with any kind of mental illness.
Do subscribe on Nursing Virus channel if you not yet done. And don't forget to click the bell icon and like button so you don't miss any videos.
Today from the part 2, question number 26 to 50, we are going to discuss. So the same kind of rules I have made. There will be 25 MCQ. You'll have 10 seconds to answer each question after reading each question. If you want additional time, you can pause the video and you can think more. You can calculate your score by yourself. If you have any doubt on any kind of questions, you can write it on the comment box. Number 26. Senseless repetition of same words or paras over and over again is known as. Here the answer C. Verbigration is correct one. Why mean? So here the person by himself will use to state the same word over and over again by himself. For example, any word it may be. Here I given one example. The person will use to keep on say the word of London, London, London by himself. None of the person will not be there in front of the client. Whereas in perseveration, when we are going and making the conversation with the patient, if you ask any question, the person will put on keeping the same word by himself. For example, if you are stating that hi, the patient will use to repeat London. If you ask how are you, the patient say London. For whatever question you ask, the person will state the same word over and over again. 27. The flight of ideas refers to which of the following? The correct answer, constant shifting from one idea to another. So always you remember when they are asking about the flight of ideas, remember about the flight. However, we are getting transmitted from one destination to other destination too fast. Here the person will use to shift from one thought to or one idea to other idea very fast or too rapid. 28. The disorder of recurrent pulling out one's own hair is called as. The correct answer, Trichotillomania. On that many occasion, we could have seen the news on the news channel. The doctors were found the bulge amount of hair on the female stomach. So those kind of cases were urged to pull the hair and they used to eat their own hair by themselves. That is called as Trichotillomania. In some cases, they won't eat the hair, only just they used to pull out the hair. And you can see that baldness or baldness over the hair side. 29. Labella indifference is related to. So here the correct answer, conversion disorder. So the person is unconcerned with the symptoms which is caused by the conversion disorder. So it is an naive, inappropriate lack of emotion or concern for that perception by others of one's own disability. 30. In schizophrenia, the term Anhedonia refers to. So the correct answer, inability to react to enjoyable or pleasurable event. For example, once the person in previous days, the person could have enjoyed the particular movies or jokes on the television, but whatever the jokes or the television, whatever the jokes the person has enjoyed in the previous days, after that condition, when the person looking the same movies or that songs, the person will not enjoy much. Just the person will look that TV and will think about something. 31. The client says to the nurse, life does not have any joy in it anymore. Things I once did for a pleasure are not fun. How would the nurse document this complaint? So the correct one, Anhedonia. As I said in the before question, the same thing only. 32. Reduced speech production is termed as. So the correct answer, mutism. So suppose if they're given another option, that is in poverty of speech instead of mutism, you can go with the poverty of speech. 33. Handy dandy, this is my work and want to shop apple pea, custard pea. This is an example of. The correct answer is word salad. So it is a manifestation of the client that involve train of words that does not have a relation, but the client keep on saying that related words. 34. Meaningless and incoherent mixture of words and paras is termed as. The correct answer is word salad. As that same example, whatever they stated in the previous question, you can take it out. Or this example also you can look out. That is that dog, cat, ate car, work, cow, mutt. And 35. An abnormal involuntary movement which occurs suddenly, repetitively, and purposeless is. The correct answer is tic. We should know the difference between the tic and mannerism. And the tic means the sudden, repetitive, and arrhythmic or a stereotyped or a motor movement, or it may be kind of an verbal tic also. Whereas on the mannerism, that is a kind of an habitual involuntary movement. For example, when the person were making the conversation, they used to shake the shoulder once, or whenever you are after giving the answer, the person may used to make that kind of mannerisms. And 36. Inability to carry out normal activity despite intact motor function is. So the correct answer is apraxia. Here clearly they stated that inability to carry out the normal activity that is related with the motor function, that automatically we can go with the apraxia. For example, whereas the person cannot able to lick one's own lip or a wink, or cannot able to whistle whenever it is necessary to do. And 37. What is the other name for the delusion of persecution? So the correct answer is paranoid delusion. So the paranoid delusion, that is nothing, always making that suspiciousness towards something or someone. Even in other name also, there is a paranoia also. If they are given, you can go with that particular option. And 38. Compulsory drinking is also known as. So the correct answer is dipsomania. So whatever the person going for the work or wherever the person were going, before that compulsory the person need to take the alcohol before doing the particular work. And 39. So what is the term used to describe an irrational fear of being in a place away from the familiar setting of one's home? So the correct one, agoraphobia. And the next one, the brontophobia, is the fear of thunder. And the remaining two phobias we'll see on the next questions. And 40, fear of high places or fear of height is known as. So the correct one, acrophobia. And 41, and fear of closed place is termed as. The correct answer is claustrophobia. We could have seen in the many movies, whenever the person were being locked inside the room, or when the person having fear to enter into that lift or stuck in the lift, they'll used to suddenly faint or will used to shout. The other phobias, there is a cytophobia, is a fear of eating, and acrophobia, fear of height, and hematrophobia is fear of sinning. And 42, an irrational fear of strangers is termed as. So here the correct one is xenophobia. So always the person used to get much fear to meet someone newly, or always will used to get much anxious or fearful where meeting that new peoples. And other phobias, there is a claustrophobia, is a fear of closed place, and algophobia, fear of pain, and acrophobia is fear of height. And 43, and what is the other name for the fear of death? So here the correct one is thanatophobia. So always the person used to get fear or anxiety about the process of death. And other phobias, there is a claustrophobia, is fear of closed place, acrophobia, fear of height, and algophobia, fear of pain. And 44, the irrational and intense fear of traveling is. So the correct one is hodophobia. So most of the time the people will use to make the confusion between the hodophobia and aerophobia. So aerophobia is a fear of flying, and zoophobia is fear of animals, and thanatophobia, the death anxiety or fear of death process. And 45, pedophilia is the form of. So actually that is the one of that sexual abuse for the child, where that person were getting abused before the age of puberty or before 13 years of age. So that is called as pedophilia. That is one of the child sexual abuse. And 46, dash involves recurrent, intense sexual urge or behaviors or sexually arousing fantasies of at least 6-month duration involving the use of non-living objects. So here the correct answer is fetishism. So the fetishism, here the term commonly they use to describe sexual deviation disorders. So where the person using that non-living object for getting the sexual gratification. And other kind of sexual deviations or paraphilias, that is a protorism. So the person used to get the sexual arousal by touching or rubbing against an unsuspecting or non-consenting person, mainly in the crowded places. And voyeurism, so a person used to get the sexual arousal by watching that other people being nagged or who are engaged in the sexual activity without knowing them. And D, exhibitionism, that is a sexually aroused by the exposure of one's own genital to an unsuspecting strangers. So mainly these things were nowadays happening in the onlines. And 47, repeated involuntary or intentional passage of feces by the child in inappropriate place after the age when the bowel control is normally expected is called. So here the correct answer is encopresis. So where the person were not only peeing in the bed, it's in any places, even after getting the proper toilet training, inappropriately if the person were passing the feces, that is considered as encopresis. Instead of the passing that feces, if they're given as that urination, that is considered as enuresis. And 48, the absence of affect is that is called as apathy. That affect is an form of an emotional area. So where the person does not having the appropriate emotion or feelings, that is considered as apathy. And 49, and repetition of similar action in similar circumstance is defined as so the correct one is habit. The person will use to keep on doing that same kind of activity for the similar situation. For example, whenever the teacher were asking the question, when the person was standing from the table, will do certain activities by himself. So that is considered as habit. And the last 51, the meaning of remission is so the correct answer is C. The disease is present, but the person does not experience the symptoms. And thanks for watching the video. I hope this terminology video become more helpful when you are preparing for any kind of nursing examination. Similar kind of this terminology video, whatever that subject you required or you need to discuss, you can write the topic or the subject on the comment box. Thank
you for watching this video. If the video is informative, subscribe my channel and like and share the video. You can write your comments too.